Welcome to the 5-Second Rule podcast. I am Lerenza Howard, one of your co-hosts, and my preferred pronouns are she, her. So I'm flying solo today as my co-host Kelly Holmes is not available. We have a phenomenal guest here with us today, Tiberius Stanescu. He is a globally educated registered nurse with a diverse clinical background, spanning multiple medical specialties. He began his nursing career in 2000, specializing in operating room procedures and plastic and reconstructive surgery. Before discovering a deep passion for long-term care, Tiberius has contributed significantly to the field through his involvement with the Certification Board of Infection Control and Epidemiology, helping to develop the long-term care certification in infection prevention exam. He is currently recertified in CIC and serves as chair of Infection Prevention and Control Canada's Long-Term Care Interest Group, underscoring his dedication to advancing infection prevention standards and enhancing care quality in long-term care settings. Welcome to the show, Tiberius.
Thank you so much for having me here today. I'm really excited to be here.
Thank you. And I know we're excited as well as we continuously grow and advance in alignment with APIC to integrate that global, health and global public health advancement. So can you briefly describe your career background and role along with how you first became involved with infection prevention in long-term care?
Yes, of course. As a leader in long-term care, I enhanced my expertise in infection prevention and also wound management. And it was during this time that I recognized how important is the safeguarding of vulnerable population and the elderly from infectious diseases. So then I started to grow an interest in systemic approaches to patient safety, and quality of care inspired me to pursue infection control as a specialized discipline. At some point, I had a presentation during IPAC GTA meetings, and then I was approached to one of the managers of IPAC in acute care settings, asking me if I would like to pursue further development of this skill in acute care. So in 2015, I transitioned into the infection prevention control team at the Scarborough Health Network, where I work right now. And here I was able to apply clinical insights and leadership experience to broader organizational context. So this proves the strengthening my commitment to advancing standards of care in long-term care as well.
Thank you, Tiberius. So I know I'm very curious to pick your brain about the Infection Prevention and Control Canada, otherwise known as IPAC, moving forward, because I've seen your involvement or the engagement that the organization has on, social media platforms such as LinkedIn, but I've been very curious to know more so on an inner working dynamic, or how is that in comparison to, what we're utilizing within the States. So, of course, you're a member of this, a multidisciplinary professional organization, IPAC is. So can you share insights on IPAC Canada's, the organization itself, and how the organization is working to support IPs at long-term care facilities?
Yes, so IPAC Canada has a long-term care interest group in which I chair approximately 900 members at this time. And this was the best growing group since the pandemic. This is an awesome support system with education sessions, information sharing, and networking. At this time, Ontario is the only province with the requirements for IP's certification in long-term care. And this became mandatory in 2022. And now IPAC Canada has a course to support the LTC IPs in long-term care.
Yes, that's very interesting that, our Ontario now requires that certification, which, and from my purview is a reflection of the benefits of having those skilled individuals having that certification. And so one of the things that, of course, I read in your bio that is very cool is that you were one of the authors of the LTC-CIP. certification. And so one of the benefits of the certification is its usability for practitioners on a global scale as we're engaging in this conversation here. So can you give some examples where the LTCIP certification helped you influence policy, secure resources, or even improve your outcomes within your facilities?
Of course. That was another one of my proud moments to be one of the authors for the LTC-CIP certification. And that provided me with an opportunity to influence and guide the content on which IPs need to study. In Ontario, IPs have now 3 years to become certified. For example, I was able to provide guidance on areas such as leadership skills, quality improvement initiatives, and microbiology, to name a few.
Absolutely. That's phenomenal. I know here in the States, we're definitely encouraging respective IPs to pursue certification. So it's great to hear on a global scale the impacts that these respective achievements can have within not only the professional career of the IP, but also the impact that it has on the organizations itself. So, what are some of the most significant infection prevention challenges that are unique to long-term care settings in Canada? And I will preface this by saying that, of course, the United States, we experienced challenges, especially during the COVID-19 pandemic in long-term care facilities. And during that time in the United States, it really highlighted the necessity of having dedicated infection prevention professionals within these organizations. And so, there are now requirements here in the United States for there to be IPs at long-term care facilities. And I know that there are growing efforts to bolster best practice within those institutions to ensure that the respective residents and patients are receiving care based on best practice. So I'll hand it on over to you regarding that question.
Of course. Yeah, thank you. I think that's a great question. And you just said pretty much the challenge in the US, probably it's going to be the same for Canada. So one of the biggest challenges that was unique to long-term care, it's the lack of standardization for IPs. Many IPs during COVID were doing IPC infection control from the bedside at the desk and did not have knowledge and understanding of infection control. And of course, similarly, like other health professionals in other health settings, staff turnover and outbreaks were very challenging. So currently in Ontario, the long-term care settings are heavily regulated by the Ministry of Health and Long-Term Care.
I find that to be very interesting that you're noting that the long-term care facilities in Canada are heavily regulated, by the Ministry of Health. And I know that even within our introductory meeting prior to recording this episode, that just really piqued my interest. So I really want for you to discuss that further so that listeners can understand the impacts of having a Ministry of Health to oversee this. So discuss more about the Ministry of Health and the oversight they provide to long-term care facilities or homes. And also, what has Canada done to bolster accountability and regulatory compliance in long-term care facilities?
Of course, that is a great question. So the Ministry of Health Fixing Long-Term Care Act that came out in 2021 requires that each licensee implements a standard or protocol for infection prevention control within their long-term care facility. And it doesn't matter if they're non-for-profit or corporation or privately owned. In Ontario, they're all regulated by the Ministry of Health. And long-term care are then inspected at least once or twice a year, or sometimes even more often, more frequently, to complete thorough audit. They usually inspectors stay for 2 weeks, reviewing multiple areas, including infection prevention. Non-compliance is then documented and publicly posted. And if it's not addressed, the homes may receive fines on the next visit of $5,000 or more. Canada is actively also addressing long-term care through several other initiatives, like long-term care residents deserve to live in dignity and comfort and respect. And that's why both the Minister of Health and the Minister of Seniors were mandated to develop national long-term care standards and the Safe Long-Term Care Act. So in January 2023, the Standards Council of Canada and then the Health Standards Organization and the Canadian Standard Association group released two new complementary independent long-term care standards. So those standards provide guidance for delivering long-term care services that are safe, reliable, and centered on resident needs. These are some efforts that reflect Canada's commitment to enhancing long-term care services and addressing the needs of its aging population.
That's inspirational. And I think that, I'm pretty sure the long-term care IPs that are listening to this episode could appreciate that, and and I think that that's a path for that we could learn from in the United States of adopting an iteration of such a regulatory system for our long-term care facilities, because as you noted, it's integral to, provide the services needed for our aging population, including having regulated long-term care facilities, ensuring that they're compliant with multiple areas within their respective facility, including infection prevention and control. So one of the things that I noted in my question is that they're regulating homes. And I want for you to clarify that, because I know I asked you this prior to recording this show, is that in Ontario, the homes are regulated as it relates to the long-term care homes itself. So can you further describe that for listeners?
Yes, through ministry guidance. So there is the Fixing Long-Term Care Act, which requires the mandated infection prevention control programs. And then there's also a standard for infection prevention control for long-term care in addition to this. So at that point, everything is condensed into regulation requirements specific to long-term care homes. And it's fully described in this standard what has to happen and what must be in place in order to have a functional protocol or program for infection prevention control in long-term care.
And the homes are where individual residents live, correct?
Yes. So long-term care homes, yes, are considered residents' home.
Okay. So what operational or staffing constraints most often limit effective infection prevention in long-term care? I know we discussed just a few of them, but from your words, what were some of those challenges?
So some of the challenges would be in long-term care, let's say, admitting residents with multi-drug resistant organisms. So homes are not usually willing to accept residents with these pathogens. So again, going back to having IPAC that leads that are certified in infection control with the LTC-CIP, there is more accepting of the information shared by those professionals for residents with CPO, let's say. So since IPAC leads became certified, there's a better understanding on helping facilities understand measures to protect residents, like CPO screenings and ensure safe care and prevent transmission. So that was one of the success stories in one of the long-term care homes that we work with, that residents are now happily living there for about 2-3 years with CPO when originally there was a pushback.
Wow, that's amazing, Tiberius. So based on what you're noting, there's a link in Ontario to, having those IPAC leads that are certified in long-term care, having those individuals present and working at those respective sites, and basically removing that barrier to the seniors being able to receive that level of care. So that's phenomenal. So from your purview, in your perspective, how has earning the APIC LTCIP certification not only deepened your infection prevention expertise and strengthen your confidence, but also increase your reliability and influence among long-term care staff? And also, how do you see its value translating across diverse global settings with varying resource levels, including cultural contexts and regulatory frameworks?
Mhm. Of course, the benefits of becoming certified are first confidence. The IPAC leads who are certified can trust themselves to make decisions and identify themselves in the role. This increases productivity and retention. Then secondly is authority. I have seen that once it is communicated that the leads are certified, they end up having greater authority in the eyes of their colleagues and resident and family councils. Also, the idea of having a local expert is very comforting in long-term care. And then the community certification leads to increased engagement in IPAC communities of practice, and because of the requirements of IPUs and also their new identity. So certification and renewal of certification means that we meet a standard of education and practice requirement in IPAC. And then it is awarded following a comprehensive examination process and provides an independent assessment of the knowledge, skills, and competencies required for a professional role. Honestly, earning my LTC-CIP really boosted my knowledge and my confidence, and it helped me see infection prevention from a broader, more strategic angle. Not just checking boxes, but really understanding how to keep the residents and staff safe day to day. It also changed how people see me. The team knows I'm not just quoting guidelines, but I can bring back things with real expertise and practical solutions, and that's built a lot of trust and made it easier to influence positive change.
I really believe that, of course, we know that that's the benefit of certification overall. More specifically in this conversation and context, the long term, the LTC-CIP as well, is bolstering and advancing that confidence in the infection preventionist. Of course, we don't know it all. However, but being able to be that leader that communicates anything that you don't know to the team and being able to effectively communicate how you will share guidance and best practice upon doing the respective research and coming back and really being a resource to the team. But also, I really love hearing the success story from our partners there in Canada on how the LTC-CIP has been a benefit in reducing barriers to the residents being able to receive long-term care facility services. Tiberius, it's been a pleasure having you on the show. Thank you for your time.
Yeah, of course. Thank you for having me here. I just want to say that I love about certification is that translates everywhere and anywhere. And then those ideas cross borders, cultures, and systems. And definitely it is worth it.
Thank you, Tiberius.
Thank you.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.